Yep.
Oh, hello, my name is Sid Parker, and today I'm going to be presenting and talking to you about type 1 diabetes. So this handsome gentleman, he's not too handsome right there. It's cute, not handsome. This handsome one right here is my older brother. Now, he's very intelligent, super smart. He works as a machinist right now. He collects and builds guns, and then he's also an avid aquarium enthusiast. But unfortunately, when he was 19, he was diagnosed with type 1 diabetes. Now, prior to this diagnosis, Luke was experiencing symptoms like constant thirst. He was always going to the bathroom, and we had a family of like 8 people sharing one bathroom, and he was like constantly in there. So it was a real struggle there for a little bit. But he also had like constant headaches, fatigue, weakness, hunger, a lot of unintentional weight loss. He was always really skinny. And then another thing to note was that his glasses prescription, they keep having to like up his glasses prescription. And again, irritability also comes with one of the symptoms. So before I get any further, what exactly is diabetes? So this is an autoimmune disease that destroys the beta cells in the pancreas. And kind of how this works is your pancreas is really important for exocrine and endocrine functions, like the metabolism and digestion functions. And so your pancreas produces beta cells, and these beta cells then go ahead and produce insulin. So they can sense when your blood sugar is high and then release that insulin, and then your blood sugar can drop. On the other side, there's also alpha cells, and those can sense when your blood sugar is low, and then they release glucagon. But yeah, so you do have to be genetically predispositioned for type 1 diabetes, but kind of getting into like that epigenetics, methylation, there are environmental factors and triggers that kind of cause you to get type 1 diabetes. So you may have the genes for type 1 diabetes and go your whole life without contracting type 1 diabetes. But, so, again, some of these triggers, they're not 100% sure on what exactly does cause type 1 diabetes, but diabetes.uk suggests it may be some of the following, like toxins, hormones, viruses, pollutants, the maternal age of your mother when she had you, stress. And one of the more interesting things that I found was that climate and temperature affected type 1 diabetes diagnosis. So you're going to find people in higher climates get more type 1 diabetes, and then also like there's going to be more people diagnosed in the winter. So funnily enough, both me and my brother got diagnosed with type 1 diabetes in February. It was really cold. It was a couple years apart, but I just do remember it being really cold after I researched it. So I was like, wow, that's so weird. But and then another thing, the American Diabetes Association even goes as far as to suggest that if you were not breastfed as a child, that may also be a trigger of getting diabetes. Very weird. So one of the first things Luke would have done after he noticed his symptoms and went to go get a formal diagnosis from a doctor is they would have performed a A1c test. So pretty much what an A1c test does, it measures the amount of HbA1c proteins in your blood. So your glucose binds to your hemoglobin, and this causes the production of these proteins. And so this test can tell pretty much how much sugar is in your blood, simplify over like about a 3-month span. So for a normal healthy individual, you want to make sure your A1c is below like 5.7. When Luke went to the hospital, he had 14, and as you can see, it's not even on the scale here, so he had it pretty bad. So they're also going to go ahead and check for some other things. Again, he mentioned how he was constantly being woken up like every 3 hours, like they had to give him like small doses of insulin, and then also check his blood sugar to try to get his sugars down and to be at a more like elevated level throughout a normal level here. But so yeah, they're going to go ahead and do like fast-acting blood sugar tests, and then another thing they're going to do is they're going to go ahead and check for like antibodies. Specifically, there's a bunch related to like insulin and the beta cells, like the ACA, GAD, IAA, and these antibodies are kind of like a marker for getting diagnosed with type 1 diabetes. But and then another important thing they're going to do is they're going to go ahead and do a urine test, and one of the things they're looking for is ketones. So again, if you do not have insulin in your body, you have all this sugar in your body and all this energy, but you cannot access it. So your body is going to start looking for other ways to get that energy. And what it's going to do, it's going to start breaking down those fat cells. When you break down these fat cells, that's going to release chemical ketones into your blood, and that makes your blood more acidic. And one of the major problems with this is it can lead to coma, and left untreated, it does cause death. Unfortunately, Luke did get went through pediatridosis twice. He was hospitalized both times. He lost a lot of weight. He was really sickly. But I'm very thankful he did not go into a coma and die. So very good. So, but yeah, anyways, getting back to the genetic portion here. So there isn't one specific gene that they can really pinpoint and go, yep, that is the gene that causes type 1 diabetes. Really, there's like a whole section of genes in the human, like to say antigen, or to simplify just the HL genes. That's kind of where they suggest that this mutation might be occurring. Again, they don't really know if it's like a deletion, insertion. They just kind of know like the roundabout area of what might be causing this. So one 2018 study by Lance Thieling and Anna Schlab kind of looked into one of the proteins that these genes code for, which is protein TXNID. And so this protein in a normal healthy individual is actually going to help promote insulin with the beta cells, as we talked about a little bit earlier. However, it does the exact opposite when you have these mutations in the HLA genes. It's going to actually cause these beta cells to not produce insulin and then pretty much kill themselves. But so, sorry, I'm going to go back here for just a second. So, S.E. Nielsen, who published a lot of diabetic research in the hereditary diabetic research, he comments like how hard it was to like kind of distinguish like if it was dominant or recessive, just because there is a lot of like high gene frequency here and a lot of genes involved. He does suspect, however, though, that it is like autosomal recessive. But again, with all the different genes to play, it's can kind of there's different cases. So, so like the highest percentage of your offspring contracting type 1 diabetes is there is like a 50% chance, which does kind of look more like a dominant rather than a recessive thing here. But again, most cases tend to be more of a recessive thing. So, like in my family, none of my parents have type 1 diabetes. Nobody that we knew really had type 1 diabetes, but both me and my brother ended up getting diagnosed with type 1 diabetes. And the American Diabetes Association kind of places like this estimate at like a 6% chance of that happening, which increases to like a 19.2 chance when you have both like the DR3 or the DR4 gene that has that mutation. So let's go ahead and talk about demographics. Like I mentioned earlier, higher climates, generally that tends to be more where Caucasian people have their roots. So you're going to have more Caucasian people being affected. About the American Diabetes Association suggests about like 0.3 of all Caucasians have type 1 diabetes, which equates to about 1.6 million people in America currently. And again, the ADL suggests that it's like the DR3 or the DR4 gene here, but with like people of African descent, it's actually like the DR7 gene, or with people of Japanese descent, like the DR9 gene. So, and then we had a 2008 Swedish study that got published in the Journal of International Medicine that kind of does show that there is this preference towards males with type 1 diabetes. And they suggest a 3 to 2 ratio here, which you might think that could possibly be sex linked. They don't know for sure, but they're going to suggest more that it could possibly be sex hormones that can kind of cause, again, these triggers. So let's go ahead and talk about treatment. You want to maintain a healthy weight. You want to keep your blood sugar level. You do that via insulin injections. Luke uses Humalog, which is a short, fast-acting insulin. He takes that before meals. And then he also has a shot he has to take in the evening that kind of just keeps his insulin pumping throughout his body and keeps it level, his blood sugar level throughout the day. So this little bit of calculations here, you want to make sure your carbohydrate counting, make sure you take the right doses. Unfortunately, he does have other complications due to type 1 diabetes, and I will get into some of that in a bit. But we did go over in class how we make synthetic insulin already, last week. But just to recap, it's the INS gene that codes for insulin. They put that into bacteria, the bacteria grows, and along with it, that gene can also multiply. And then they can extract that gene and purify it, and that becomes the insulin. So again, how insulin works, you have your cell, you got your cell receptor. Your cell receptor is like the keyhole, your insulin is like the key. It's going to unlock and allow glucose into the body. And so pretty much synthetic insulin works the exact same way. Just one of the things to take note of is your pancreas is not there to be able to calculate how much you need. So that is on the patient to be able to correctly give themselves the right dosage. If they give themselves too much, that can cause hypoglycemia, which has another load of issues. And then if they don't give the right dose, that can cause the opposite, hyperglycemia, which again kind of relates back to the ketoacidosis that we talked about earlier. So again, because Luke went so long without a proper diagnosis and he went untreated, this has caused a lot of complications for him. Currently, he's dealing with hyperthyroidism. He also has neuropathy, which is the nerves in your feet are acting up, and so he has a lot of pain with walking currently. He's also dealing with gastroparesis, which is kind of just like stomach issues, and then also he has a lot of eye problems. So for Luke's future, hypothetically, if he keeps at it, he doesn't need any help, he'll be fully functioning. However, if the patient does not properly take care of themselves and give themselves the right dosage, it might be helpful for them to have somebody, a family member, just to be able to give them shots, check their blood, make sure everything's going peachy. And so WebMD actually suggests that most diabetics are going to live a long, happy, healthy life. They suggest that men can live around 66 years, women can live to be 68. So overall, if you take care of your health, you will be good. So here is all of the most popular diabetic foundations that I found. The American Diabetes Association was really helpful with me finding a lot of information. You've got the JDRF, the NIH, and again, these foundations help support diabetics through means of funding, research, and just general advice for families and those afflicted. So again, go out there, thank your pancreas. It's doing a really hard job. But here are my words cited, and I really, again, want to thank you guys for your time. You were a very wonderful audience.